how to deal with symptoms when they could in theory be MEN1 related, but also they might not be as well. So these might be very common very very common symptoms like tiredness and fatigue, which happens to a lot of us with this condition. Joint pain is another one, and sometimes it's very difficult to know what exactly to put the symptom down to. So my take on this is it's always worth, whenever something comes up with your health and you have MEN1 and you know it's there, book the blood test, just get them booked in. We have a system now that's there to support us, and most consultants are really happy for you to send them an email and say, I'm feeling like this, could I just get this checked out? And I think that's a really, really sensible thing to do. In fact, it's an imperative thing to do, because we do need to have sight of what's going on inside our body, and yeah, just to kind of monitor that all and make sure that there isn't anything really untoward. And often if it is something MEN1 related, then the bloods will bring that information back very quickly. The second thing that I find really helpful is to do a bit of my own research. And by this I mean not jumping to Google and Googling my symptoms, because it will probably tell me that I'm about to die or I need to call 999. Absolutely not the case. What I mean is ask around the MEN1 community, ask patients with the same condition if they've had a similar experience. Just ask around generally as well, because very often there is a temptation, I think, to try and link everything back to MEN1, because that would give it a logical explanation or a logical answer. And sometimes that isn't the case, but if it is the case, it's worth knowing. And it's worth knowing what other people are going through too, so that you don't feel like it's just you. So I would say ask around and yeah, see if there's anyone else who can relate to what you're going through. Third thing, slightly related to what I've just said, on the basis that we are ultimately all humans, and we are, as MEN1 patients, going to experience the same symptoms that anyone else without a diagnosis experiences. Sit with the question, what would I do if I didn't have MEN1? If I'm now tired, or I have pain in my joints, or I'm feeling a little bit fuzzy, and I didn't have MEN1, what actually would I do? Because very often the symptoms we have in MEN1 are exaggerated symptoms of what anyone else could feel, and they're caused by, obviously, as we know, some kind of mishappenings going on in the body. What that means is that then the solution for those problems, those symptoms that we're feeling, can often be had, or can often be found in doing what anyone else would do without the condition, added with a little bit of extra help on top. So I know in my experience, when I've been overly tired and it has come back that my calcium's been high, I also think about, well, actually, okay, if my body's telling me I'm tired and I know it's the high calcium and whether or not I'm on medication to manage it, how can I respond to that? How would anyone else respond to that? Is it with rest? Or am I tired because, I'm using too much energy at certain times of day? So I think it's really important to remember that whilst being an MEN1 patient and there is this diagnosis, you're going to be having the same bodily experiences as anyone else. And yes, it's really important to get them checked out. But it's also important not to assume it's always MEN1. And actually, sometimes the magic bullet is in the solution, which, any Joe Blogs on the street would go to. And that's been my experience.